Hey guys, this is Zach Hutchinson with Continuing Hope, and this is Breaking the Stigma. I have a very important guest today. I have Dr. Garwin from the Albany Clinic, and he is going to be going over a lot of information with us today. Welcome to the show, Dr. Garwin.
Thank you. I appreciate it.
I appreciate you being on here this morning. You're a very busy man. I appreciate you cutting out some time. I do want to give a shout out to the sponsor today, Fowler Heating and Cooling, located at 423 South Court Street in Marion, 618-997-5288. If you have any heating or cooling needs, Steve will take care of you. So I just want to get straight into it with Dr. Garwin and just have you introduce yourself and, basically what you've done in your career. I know what you've done because I've talked to you several times, but if you can just tell us what you've had going on since you got out of school.
Well, my name is Dr. Mark Garwin, and I am a physician anesthesiologist. I went to medical school at University of Oklahoma in Oklahoma City. I did an internship in surgery at the Medical University of South Carolina. I did my residency in anesthesiology at the Mayo Clinic. I did a fellowship in cardiovascular anesthesia critical care medicine at the Mayo Clinic. After I left the Mayo Clinic, I went to Boston and I taught at Harvard Medical School for a couple of years. And then I went into private practice, first at a hospital in Odessa, Texas, and currently, and have been for the last 30-something years, in Carbondale, Illinois.
Right, for SIH, correct?
Currently, yes.
Yeah, I knew you. I knew you were on call a lot, and you're at the hospitals a lot. I just, there is so much. There's so much background to you. I wasn't sure where all you had been, but I know you are extremely well versed in everything we're getting ready to talk about, and I know that you've been doing anesthesia for a long, long time, and I personally trust you with my life, and I know other people that's been to your clinic do too. I just want to get into some questions here, if you don't mind. I'm wanting to ask, what if someone does not have a mental health care provider? Can they come in and schedule a procedure? Can they schedule a consultation, or do they have to, see a provider first? How do they get to you?
Anybody can schedule a consultation. We will do a consultation for free without a mental health care referral.
Okay.
However, I need to have patients in the care of somebody who is taking care of the mental health care needs. The techniques that I use here at the clinic are not cures. They're bridges to long-term therapy, so somebody else needs to be involved as a mental health care professional. I need to be able to refer patients back to somebody.
Yes, and that makes total sense because, I've done procedures at your clinic, and, without Morgan Gant, tweaking my medications and working with me as I was going through my procedures, I never would have been where I'm at now. And I know from yours and I's conversation, I am night and day from the day I first saw you. And so it's funny that you mention a bridge, because I was trying to explain on the last episode, the bridge is to go get your procedures and then use that to allow your medication to take over and to get you where you need to go and to keep going where you go. And that's it's perfect, because that's exactly what I did. And that leads into my next question. The stellate ganglion block is something at Continuing Hope, which is my charity. Continuing Hope is meant to financially assist vets and first responders that are getting these procedures. And I want to go straight into the stellate ganglion block. Now, that is to me, that's the king of the PTSD treatments, because I've had it. Can you tell us what that procedure is and what it exactly does for treating PTSD?
So there is an excitatory center in your brain. It is called the amygdala, and it is responsible for the threat awareness, the fight or flight response, and the startle reflex. And that is a reflex. When you hear a sound, a noise that is unexpected, and you turn your head, that's a reflex. And that response by the amygdala is counteracted by a higher center in your brain, a cortical center that processes the same information. Under ordinary circumstances, that amygdala and the prefrontal cortex moderate each other. When somebody, for example, a combat soldier is in combat, the amygdala runs hot all the time.
Okay.
And the prefrontal cortex is subordinated to the amygdalas. So that's how people stay alive. When they come back home, that reset doesn't occur in everybody. And the stellate ganglion block is to reset the balance between the amygdala and the prefrontal cortex.
Oh, wow. You know, I never have heard you explain it that way. But that makes a lot of sense, actually. So you're saying when they're over there, they have so much adrenaline, and then when they get back, what doesn't reset exactly? I'm trying to understand what you meant does not reset whenever they get back.
There's a balance between the higher cortical center, the prefrontal cortex,
Okay.
and the amygdala. And the same sensory input goes to both places, and the amygdala says run, and the higher cortical center says somebody just dropped a carton of milk. You don't need to hit the floor, roll over, and look for a combatant.
I got you. So when these
On
guys,
the other hand, in combat, the amygdala runs hot all the time, because if you take your time to think about what is going on, you probably won't do well.
Right.
You have to reflexively respond. But when you come back stateside, it's different, and you can't respond the same way you would in a combat situation.
Right. So when you're out at Kroger and someone, drops something heavy on the floor, instead of you thinking it's a gunshot, you'll understand that it's just somebody dropping something, and that's what the stellate does. I totally get it. I didn't have any of that kind of trauma, so my stellate that I got wasn't really like that. But I know that talking to the vets, they are saying that's exactly what happens to them. So, how do you do the procedure? I've told some people that it is a shot in the neck, and the first thing they always say is, "Oh, I don't want that." But it's not bad at all. I said that on my last episode, on my last podcast. It's not bad at all. And I just want to have you explain how it's performed, and possibly what are the possible risks of this?
So the stellate ganglion is a cluster of nerves in the neck. It's part of the sympathetic nervous system that is responsible for the fight or flight response. And it's located about halfway between the ear and the clavicle. And what I do is take an ultrasound machine to locate that cluster of nerves and inject a local long-acting anesthetic around it. And it blocks the sympathetic inflow back into the brain. And I do that with patients sedated, so that people are basically asleep for the entire procedure.
Okay. That was one of my questions. I know that obviously because I've had procedures there, but for people that are listening to this, vets, even just civilians that are not in the military, I want them to know that it's not scary. It's not a scary procedure. As good as I do, I hate needles. I'm not a needle guy. And so when I heard about the shot, I was like, man, I don't know about that. But then to know that you're basically under anesthesia, or you're basically asleep, no big deal. I mean, I wake up, I don't even know where the shot was, other than the fact that there's a little red spot there. Now, are there any risks to this, to guys that have talked to counselors that have said, "Oh, I wouldn't do that. That's brand new," or something like that? Can you elaborate on that?
Well, a stellate ganglion block has been around for about 100 years, so it is not new. It has been used for decades to control pain that is because of the sympathetic nervous system. So it is a proven technique, and like any technique, there are some risks. They're very small, but anytime you use medication around nerves and blood vessels, you always take a chance somebody can react. However, we are prepared for those kinds of issues, but it is a procedure.
Yeah. And the main side effect that I've noticed, I've had a couple of these, a couple of these stellates, and the main side effect I notice is just a little bit of a sore throat, and my eye is a little droopy, and you explained to me because of where the medication lands, and so that's the only side effect I've ever had. I mean, I haven't had anything happen days after, other than the fact that I feel really good. Now, what are the advantages over other treatment methods? Like some of these guys, they've been to counseling, they've taken all kinds of medication. I had a combat vet on the show a few days ago, and he was telling me a laundry list of medication he had taken. He doesn't even remember it all. But when he went to get the Stellate, it was like everything changed for him, and he was really happy. So, is it something where these people need to be, they need to try several of these PTSD medications to come and see you, or what would you recommend in that situation?
Well, the patients who come to me at the clinic for PTSD problems are generally referred by a mental health care provider who has treated patients with medications that have not been effective.
Right.
And most of the medications that are prescribed for PTSD take 8 to 12 weeks to get to a steady state. And at that point, people don't know if the dose is right or if the drug is right. So the purpose of the stellate ganglion is basically to reset that balance in your head and to allow you to have the time and the space necessary to adjust medications and to engage in therapy.
Okay.
Most of the time, patients who have PTSD for whom medications haven't worked get frustrated and they drop out of the system.
Yes. They just give up, because there's no, and that's kind of how I was. I didn't realize there was anything that would do this. That would actually help this much. And, I didn't even know I had PTSD. I'll get into that later. But so to answer the question, the advantages over other treatment methods basically is the fact that this works extremely quick, and that it will allow you a little bit of a grace period, if you will, to get your medication working. Is that how you would explain it?
There are some patients for whom a stellate ganglion block will address the problems of PTSD for an extended period. Most patients will need to continue with medications and or therapy, but every patient is different. But the stellate is extremely effective in addressing the hyperreactivity aspects of PTSD, that kind of heightened startle reflex, and also the intrusive thoughts, the nightmares, the re-experiencing of traumatic events. And that is something that the stellate is very good at.
Oh yeah, absolutely. What is you were talking about how successful it was. What is the success rate of the stellate? I guess maybe at your clinic or maybe some literature that you've read.
Well, in the literature, medical literature, in journals, as well as here, our success rate in terms of having a significant improvement in the patient is probably 85-90%.
Wow. That's that's amazing.
I mean, these things work. And
Yeah,
that, in fact, is the key to all of it, is these things work.
man, 85, 90%, that's, I don't know what the percentage is of people who try medication, but I can tell you in my experience that I have went through a laundry list of medications, antipsychotics, the benzos, but, I've taken them all. And it was kind of like you said, some of this stuff takes 8 to 12 weeks to work. You got side effects, in men especially, get the terrible sexual side effects, and they last for months. And to get something so quick, and that works so quick is just amazing. And I'm so glad you've got the clinic over there, and you can help people like me and vets, because it's such a great procedure. Now, you said that everyone's different, and everybody's different. Some people it'll last a long time for. How long is an average? Do you have an average time that it usually works on people, or is it just completely different on everybody?
There is variability in it, to the extent that some people will get immediate relief,
Mm-hmm.
and it lasts to the point where I haven't seen them back because they don't need to.
Yeah.
Most patients, they can get relief immediately or after a day or so, and it will last 3 months, 6 months before they feel the need to go ahead and do it again.
Okay.
But yes, everybody is different, and every time is different.
Absolutely. Well, I had the combat vet on the other day, Scott Van Duker, and he's had a procedure. I believe he's had 2 procedures at your clinic, he said. And he was telling me that he lasted almost 5 months off of the first one. And he said, I asked him, we were just having a conversation before the podcast, and I said, how did you start noticing that you needed another one? And he said very slowly his symptoms started coming back, which I think is really cool because you don't want all of that to hit you at one time. So basically, he was saying his symptoms started coming back. He started noticing a little bit, and then he got in for a shot, and he said basically he got the shot at the same time the symptoms were coming, so he never did get as bad as he was. And that's amazing, because if someone goes from the very bottom and then they go up and they feel good and then they come back down to the very bottom, you know what that does to me? That discourages me to the point where I just want to end it. I just think, you know what, this isn't working. I'm not doing this anymore. But the fact that this thing kind of tapers off is amazing to me. So I want to get into, we talked about having more procedures. Let me get into the next part of this, which is the ketamine IV infusion. For those of you who don't know, Dr. Garwin at the Albany Clinic also offers ketamine IV infusions, which are meant for severe depression. And I'm going to let Dr. Garwin explain a little bit of that to you. What is the success rate of that? And is that something that works for PTSD? I was told it's for depression, but is that something that can also work for PTSD?
Well, ketamine also is effective for a significant number of patients with PTSD. Mm-hmm. Ketamine was developed as an anesthetic for battlefield circumstances back in the 1960s. It was used extensively in Vietnam. But it is a dissociative drug, which means that when you come out of the anesthetic, that you can have visions or experiences that you consider to be unsettling. So when PTSD became a significant issue with veterans returning from Afghanistan and Iraq, the Army started looking at whether patients who received ketamine were at higher risk for PTSD, mm-hmm. and they found the opposite to be true, that patients who had received ketamine had a lower incidence of PTSD.
Oh, wow.
Ketamine is a rapid-acting antidepressant. It works in a different manner than the standard antidepressants that are prescribed by mouth, pills that are taken, and it works quickly. And it does have a sustained mechanism, but it often requires more than one infusion. The average is probably 3 to 6.
Right.
But at the clinic, at our clinic, everything is driven by the patient. And oftentimes we'll do one infusion or a second infusion, and people do well for months and then come back when they feel that they are slipping and going backwards. But it is useful for both treatment-resistant depression and for some of the aspects of PTSD, in particular the depressive aspects of PTSD.
Yeah, I noticed myself when I first came to your clinic. I first came for severe depression. I was just so depressed when I came there, and I remember doing. You had told me that it would probably take a few infusions, and I remember doing the infusions, and like each time, I gradually felt better. So it's kind of like the ketamine kind of builds up and builds up and builds up. Now, how will we notice, for people who get these, how will we notice that we're needing another ketamine infusion? Does it kind of taper off the same way as the shot does, in your opinion?
Well, there are two types of depression. There's depression that is caused by external events, and those things like losing your job, breaking up with your girl, are depressive events. They are triggers. But you also have a baseline emotional state. And when you have depression that is a consequence of an imbalance internally, ketamine helps reset that balance, kind of like the stellate ganglion does for hyperreactivity and intrusive thoughts.
Okay.
So when people understand that they are sliding back into a depressive mode that is not because of triggers, they know when it is time to come back in.
Okay, that answers my question, and that answers my question personally, because that question was for me. I want to know when I need to know to come back and see you. And you know, I'm hoping that you always describe it as a bridge to me, and I'm hoping that the procedures I did at your clinic and the medicine that I'm on now that Morgan Gann has got me lined out on, I'm hoping that it will go a long time. And like I said the other day, I love coming over and shooting the breeze with you, but I just I hope that I don't have to come shoot the breeze with you for a while, you know. So, you know, it's a one of those deals. So my next question is, now for the military, the vets and things like that, my charity, Continuing Hope, is going to offset the cost of this. But can you tell us how much the IV therapy costs? If you were to just come in, say you went to Morgan Gant, and you weren't in the military, and she said, hey, you know, you're treatment resistant to this depression. I think you need to go see Dr. Garwin. What would it cost a patient to come and do that? You said the consultation was free. What is the procedure?
The ketamine infusions are often not covered by insurance because they have the ability to deny payment for them.
Okay.
The infusions cost $450, and the stellate ganglion block is $1,125.
Okay.
Those are based on the codes that are used for insurance billing for medical procedures. So we will provide the information to patients so that they can submit that to insurance companies in the event that an insurance company will cover the cost.
Okay.
But I don't know whether the insurance companies will or will not.
I really don't know that either. I never turned any of my stuff in. We have insurance through my wife, and I don't know if it did either. They don't cover a lot of things like that, so we didn't imagine they would. But you know, it's awesome that you're so close, because you know, I had researched ketamine IV oh man, maybe 3 to 4 years ago. A friend of mine out in Colorado had been getting it done. Um, she was getting it done intranasal. I think she was getting it done through her nose, and then she was also getting IV. And so I had been researching it for a long, long time, and I could not find any clinics anywhere close to here. The closest one I think was in Clarksville, Tennessee, or Nashville, Tennessee. I can't remember. But anyway, they made you pretty much go get a hotel room and stay down there for a week so you could get your procedures done. What kind of rules do you have at the Albany Clinic as far as somebody coming in? Can someone just drive themselves there and get a ketamine infusion and then drive home, or?
Well, you have to have a consultation,
Right.
and you need to be in the care of somebody, a mental health care professional.
Mhm.
And on the day of the infusion or the stellate, you need to have somebody drive you there and drive you home.
Okay.
You cannot drive on the day of the procedure, and there are restrictions on what and when you can eat and drink prior to the procedure, but that depends on the time of the day.
Okay.
There
Yeah.
are clinics that do ketamine infusions that require that you have 3 or 6 and pay in advance. And at the Albany Clinic, it is driven by patient needs. So we'll do one and see how you do.
Yeah.
And if you need more, we'll do more. But if you don't, then we will not.
I have went through those questions with you personally when I first came there, and I appreciate your honesty and your basically your willingness to help people without making them pay for all these procedures up front. Because when I did check in Tennessee, I think you had to pay for 16 procedures, or you had to pay for 6 up front, and they were. Man, I'm thinking they're $600 a piece down there or something. I mean, it was quite a bit of change, and then they wanted you to get a hotel because they didn't want you like driving back and forth. You basically had to do them over a week or something, and I just thought, man, nobody's going to be able to do this, And I mean, I didn't even want to go do it. And then when you came here, and I went and did my consultation, and I found out, you always talk about everything being patient driven, and like one patient might come in there. I know a girl that went in there for a ketamine infusion, and she called me the next day, and the exact words out of her mouth were, "I feel like this is the first day of the rest of my life." And I said, "Really?" I said, "It did that much?" She's like, "Oh yeah. See, I feel great. So I slept great. I woke up great. I feel energetic." And after my first ketamine infusion, I didn't feel like that. I think the anesthesia just kind of made me kind of tired, and it kind of took a couple days for it to work. But then as I got some other procedures, I really started bumping up. I really started feeling that depression going away. I started feeling the just a better mood around the kids and around my wife and stuff. And then when I jumped over to the Stellate block, I guess I can get into that story now because I didn't even know I had PTSD. I swore that I was just depressed, basically bipolar. I had no idea. And my wife, who was dead set on trying to get me to feel better, and I know you were too, we started looking into the PTSD. Now, I know you can't tell us what the questions are on here, but tell us about the PTSD test that I took. How do you determine just from that test that someone may have PTSD? Anything sticks out on that test that would really tell you?
Well, it's what's called a PCL-5. It is a questionnaire that was developed by the military to assess PTSD in veterans. And it takes maybe 5-10 minutes to fill out. And it is a scoring system and is a question of what your total score is. There are questions about sleeping, about hyperreactivity, about depression, about withdrawal from circumstances or people.
Mm-hmm.
And you add that up, and it gives an assessment as to whether you have PTSD.
Yeah, and I remember taking this test, and I thought you were going to come back and laugh at me and say, you don't have PTSD. But when I talked to my wife, she was kind of smiling at me, and I said, "What?" She said, "Well, you scored really high. And I said, well, it's good. It's like, no, it's not good. That's not good. That's terrible.
No,
And,
that's not it. That is not a good thing.
no,
But it tells you where you start. And in the clinical trials, the medical clinical trials published in the journals, the cutoff on the scoring is at 40, and you were somewhere up in the high 60s or 70s, if I recall. And after the first stellate, you were down in the 30s.
Oh, I remember coming back and taking that test again, and you told me that. You said you're way down, you know, and it was amazing. All the things I read, and like I said, I'm not going to tell people what's on the test because I think it's important that they take that without prior knowledge, but everything that I answered on the questionnaire, it was like, I thought I was filling out the wrong form. I thought this has to be a form for depression and all the stuff that I've been dealing with, but it come to find out, I had just been treating the depression all these years and didn't know I had the PTSD. And once I got that stellate, you know, I got it, let's say I got it on a Monday. It took a couple days for mine to take action, but I remember sitting at the kitchen table and I turned around to my wife. I said, hey, Erin, I'm happy. I said, I think I'm happy. And she's like, I think you are too. And I said, well, why would you say that? And she said, because of the way you're acting around the kids, the way you're acting around the house. She said, you're keeping yourself busy. You're not just sitting there sad and stuff. So, you know, I am a walking, talking commercial for your clinic. Your clinic has completely changed my life as well as other people's lives. And you know, I just appreciate you doing this so much. You know, I know you've been in the medical field for years and years and years. And while some guys are retiring and you know they're kind of done, you know, you're getting started on something that is saving people's lives, and I just think that's incredible. I commend you for that, and I've had a great time getting to know you, and I consider you as a friend. You know. We've gotten to know each other over the past several months, and you know, you coming on the show now is really showing people what I've been telling them, because I've been telling people about the Albany Clinic. I've been telling people that I know that have depression to go get ketamine. I've been telling people PTSD, you should go check on the shot, and you know, to have you on this podcast and actually explain what all this stuff is medically is great, because I can only say so much. The terms you mentioned earlier, I don't know any of those. So I just tell people, hey, it makes you feel good, you know? So, but yeah, I think what you're doing is amazing. Now, these vets, let me ask you this. How many vets right now, this will be the last question I've got for you because I know you're busy and you're on call. These vets here that are coming in, how many of these guys do you think need treatments right now that cannot afford them? And the reason I ask you this is not to be nosy, but the reason I ask you this is because each month we're going to try to have a goal for Continuing Hope. How much money should we be looking to raise this month? I mean, on average, how many guys a month do you have come in that need financial assistance for these treatments?
Honestly, Zach, I don't know how to answer that, because there are vets out there, first responders, women who have experienced sexual trauma, all of whom have PTSD, but in part because they can't afford it, and because they can't afford it, they don't come in or don't come back. It's really hard to tell.
Okay.
But I can tell you, we have a number of veterans for whom we simply don't charge what we usually charge, because they cannot afford it, and I just can't tell them no.
Right, and that is why I have you on the show. It's why I respect you so much. I know that you do help those guys with a lowered rate and stuff like that. I've heard that. And again, Continuing Hope is just for vets, first responders, you know, things like that. We've done that to support the military and the first responders. So we really want to, if you're a vet and you're listening to this podcast and you're thinking about going to the Albany Clinic, when you get there, talk to Dr. Garwin. And if you can't afford the procedure, let him know. and he will get with us, and we will get it taken care of for you, because that is strictly what my charity is set out to do. We really want these guys to, if they've been overseas, they've been at war, or a police officer has went up on a car accident and seen a little kid, fatally injured, and it gave him PTSD. We want those guys to be right back out there working. We want them to be healthy. We want their minds to be clear, and so that's why we are covering those procedures. So if you're listening to this and you think, hey, I'm a vet or a first responder, but I don't think I can afford this because my insurance doesn't cover it, go ahead and make your consultation, and let's see if we can help you out. Dr. Garwin, I appreciate you coming on the show. Do you have anything else to add before we let you get back to it?
Well, I just want to thank you for your help, because the veterans out there need help. There are 20 a day who are committing suicide,
right? And
we can help people with that.
Absolutely. Well, I really appreciate your time. I know you're busy. I'm going to let you get back to it, and I guess we'll be talking soon.
We will.
Okay, thanks a lot, Dr. Garwin. We'll talk. Okay, you're welcome. We'll talk to you soon. And there he was, Dr. Mark Garwin from the Albany Clinic. Guys, I just want to tell you, I wouldn't say this to him because I don't want to make him uncomfortable or give him a big head, but that guy's the real deal. He has been doing this years and years and years, and I'll tell you this much. Where a lot of guys that have been doing this are retiring and stuff like that, he's just opened his clinic up. He does this at night and on the weekends so he can help people. When I first went in to see him, I was in terrible shape. And I remember him sitting in the room with me, just talking to me for the longest times, just telling me, we're going to get through this. We're going to get you better. And when I got my shot, he's calling me days after, checking on me, making sure I'm okay. And I really just want you to consider, if you're having PTSD or depression and you're at the bottom, what you think is the bottom is not the bottom. You're only going to come up from here. And I really wish that you would go for a consultation and just see what it's about. Don't let this stuff linger in your mind, because it doesn't have to. There are aggressive treatments available now, so you don't have to take a handful of pills every day and hope they work. Really good procedures over there, and I would recommend anybody to go to them. And just wrapping up the show today, I want to thank you guys for joining us. We've had 4 great podcasts about Continuing Hope. You can find Continuing Hope on Facebook at facebook.com/Continuing Hope, or you can find us on the web at continuinghope.com. There are donation links on both pages, and we would love to have you donate if you can. I hope you guys are very successful. You have a great day, and we'll talk soon. Thank you.